Today I am going to discuss pros and cons associated with DPP4 inhibitors, alarming situation, when and how to handle it. So at the end of the presentation, you should be able to know about the pharmacology of DPP4 inhibitors, medication in diabetes, and describe the clinical application of gliptins. Discuss guideline-based approach in choosing DPP4 inhibitors in the management of diabetes mellitus and the adverse effect of DPP4 inhibitors. So, what is the goal of treatment with oral hypoglycemic agent in diabetes mellitus? Our goals are: number 1, control the hyperglycemia; number 2, minimal adverse effect in the form of hypoglycemia, and limit the toxicity of the treatment and adverse effect; maintain the quality of life and psychological well-being. Most important objective: prevent or delay the acute and chronic complication of diabetes mellitus. So the blood sugar level, what should be the target of blood sugar level? It should be fasting less than 126 and random it should be about 160 to 180 postprandial. But in certain cases, especially in old age with multiple comorbidities and patient has low cognition, then the optimal level of HbA1c keep around 8%. Know what are the DPP4 inhibitors? These are the medications which inhibit the enzyme DPP4. That enzyme increase the incretin effect 3 to 4 fold by inhibiting the enzyme. That lead to increase the concentration of GLP and GIP, glucagon-like peptide and GIP hormone. That in response to increase in blood level, they release the insulin from the beta cell of the pancreas in response to hyperglycemia. Number 2, inhibit glucagon release. Both these two facts ultimately lower the blood sugar levels. All this mechanism happened in the form of hyperglycemia. This is the reason DPP4 inhibitors did not cause hypoglycemia. Another benefit of this mechanism is it controls the sugar postprandially. So these are the some medications most commonly used is sitagliptin, saxagliptin, alogliptin, vildagliptin, and now the latest is the linagliptins. Is the most that is the no need of treatment or a dose adjustment requirement in renal failure. So what is the pharmacological effect of DPP4 inhibitors? So these are the few effects of DPP4 on diabetic patients. Obviously, number 1 is the most important is the control of glycemia, which seems to be reflect in the form of HbA1c, and it controls the HbA1c 0.4 to 0.8%. Effect of hypoglycemic adverse effect is almost nil. It does not cause weight gain or weight loss, and minimal effect on genitourinary or renal. Only with other than linagliptins require after 50% GFR dose adjustment is required. GIT side effect minimal. Heart failure, possible risk for sexagliptin and allogliptins. Atherosclerosis, cardiovascular disease, it no beneficial or adverse effect on ASCVD. It has no effect on bone, and these medications do not cause ketoacidosis. No, what are the indications when to prescribe DPP4 inhibitors? As we know, this is the algorithm that provides by International Diabetes Federation that describes the broad framework of glucose control therapy. In this framework, after lifestyle intervention, metformin is the first line medical therapy, and second line therapy sulfonylurea, thiazolidinedione, DPP4 inhibitors, acarbose, GLP, glucagon-like peptides analog, and obviously the third line is the premixed insulin or bolus insulin, basal insulin, and fourth line treatment is the pre-meal insulin and basal insulin. So this is a summary of treatment of type 2 diabetes mellitus. Before prescribing, first of all, consider the few precautions. Number one, think about the adverse effect of comorbidities of the patients. If patient has cardiovascular disease or chronic kidney disease, then prescribe the DPP4 inhibitor as third line therapy. If the patient has CKD, chronic kidney disease, then prescribe as third line medication therapy. If patient has no cardiovascular disease or chronic kidney disease, then think about the risk of hypoglycemia. If there is a risk of hypoglycemia, then prescribe the DPP4 as second line. If weight loss or minimizing weight gain are important, then DPP4 inhibitors as prescribed as third line therapy. Number 3, very important, if patient is unable to afford the costly medication, then avoid to prescribe DPP4 inhibitor because these are costly, and prescribe after sulfonylurea, thiazolidinedione as fourth line medications. Now, very important, when not to prescribe. Before prescribing, after ruling out the comorbidities and side effect, then consider the few important things. The most important thing, the disease of the pancreas. If previously patient has risk of pancreatitis or pancreatic disease, then do not prescribe the DPP4 inhibitors, as the DPP4 inhibitors increase the risk of pancreatitis. If patient does not have history of pancreatitis but has risk factor of pancreatitis like gallstone, history of alcohol intake, history of hypertriglyceridemia more than 500 milligram, or hypercalcemia, then avoid to prescribe the DPP4 inhibitor as the risk of pancreatitis increased 2 to 3 fold. So these are the very important precautions. Let's summarize the things. DPP4 inhibitors, well tolerated oral medication, and target postprandial glucose level. It do not cause weight change or hypoglycemia. And with moderate or severe renal insufficiency, dose adjustment is recommended except for linagliptins. Limited use due to limited reduction in HbA1c, high cost, and it associated with pancreatitis and heart failure, hospitalization with saxagliptins. Thank you very much.